The chairman of the Republican National Committee, Michael Steele. He joins us live from the Republican National Committee studios in Washington, D.C. Mr. Chairman, it's great to see you. Thanks for coming.
Hey, Shep, good to be with you, man.
Your thoughts on the bill that was passed by the Senate Finance Committee today?
Well, I'm disappointed that they still refuse to go to where the American people want them to go, and that's
to a public option.
No public. I mean,
actually, the polls show that the American people want a public option.
Yeah, okay. I'll buy. I got a bridge to sell you as well. But the reality of it is, look, this bill that was just passed out has more government, it has more taxes. It's not the kind of reform that people are looking for.
What kind are they looking for?
I think they're looking for a comprehensive, slow growth approach. In other words, a bottom-up strategy that will tackle the main concerns that they have with health care, and that's cost. So why don't we talk about portability? Why aren't we talking about
portability, meaning buying across state lines, which is illegal
buying
right
across
now.
State lines, allowing small business owners to collect in pools and go into the insurance market to get the best deals for their employees who otherwise don't have that insurance. So there are a lot of things, and you don't need a massive overhaul of our health care system to do that, Shep. And I think that, again, look, the Democrats have an agenda, and their agenda is to do a health care system that involves more government, more regulation, more control at the federal level. Republicans have argued from day one through the 800 or so bills that were introduced in the House and the three committees there for H.R. 3200 that dealt with at least those things that I just mentioned, plus others. So the reality of it is we're at two different spots here on the playing field with respect to whether or not we're going to get true health care reform. This bill doesn't do it.
Why are Republicans against a public option?
Because it's government-run health care. It's government control.
It's not government control, Mr. Chairman, with great respect. With great respect. It's not government control at all. As it has been laid out, it would be a government-run...
Really? And you believe this, Shep, you believe this, with all respect, you believe this.
I can tell you that what the Democrats... What the Democrats proposed, with great respect, what the Democrats proposed... It's a satellite delay. It sounds like we're being mean to each other, and
we're not.
We're good friends, and we wouldn't do that.
Go ahead.
But the truth is that the government-run or public option would be an effort to keep the costs down by allowing those who wanted to come to the government option and a not-for-profit option in an effort to keep the costs down and offer an alternative. But Republicans are against that, and I'm curious why. Because the Democrats say it's because you're in the pockets of the insurance companies, and that in fact even Olympia Snow's greatest contributor is the insurance industry.
Well, you know, you did a great rendition of the Democrat talking point.
I'm telling you what they say. I'm going to do the same thing with Bill Nelson in a minute. I'd just like to know your thought.
No, I know, and I'm going to give you straight up. I think everything you just said is absolutely inaccurate. And I think the fact is that once the government gets his fingers in this particular pie, it is going to grab for more of it. And the individual will lose those options. Employers, I mean, Shep, if you're a small business owner and you've got the federal government that's going to pay the difference between your costs and what the employee is paying, who's going to, you're going to take that cost and keep it? No, you're going to tell your employees, guess what, you're in the public option.
Anecdotally, that's already happening.
This idea that you somehow are going to have a choice in the matter is not the case. And the reason employers are not necessarily providing that insurance for some of their employees is because they can't afford it. It gets back to the core point that insurance costs to employees, employers, insurance like you or me who need insurance is skyrocketing. And so let's address the cost. The administration has yet to really come to the table to tell us how all of this is going to be paid for, what taxes are going to go up, and are we really going to have to cut Medicaid or Medicare, for example, to help pay for this? So all I'm asking for is an honest debate. Just don't go and rush through another vote in the Senate or the House and say you're doing reform when all you're doing is growing government, increasing taxes, and spending money people don't have.
Right now what we have is a private health care system, and it's been working, depending on your experience, well or not so well over a period of years. But one of the things about privately run anything is when it's privately run, you go in, you pay for it, you get the benefits, and if you don't pay, you don't get the benefits. But this is America. And people go to the emergency room at the very last minute. They haven't had health insurance. They haven't had their tickers taken care of. They haven't gotten their liver taken care of, and their foot's rotting off. You go to the emergency room. We don't let you die on the table. We fix it, and all the rest of us pay for it. So it's sort of a flawed system to begin with, isn't it? Because even if you don't have insurance, God knows we're not going to let poor people who don't have anything die on the emergency room table, and this just isn't working.
Well, Shep, I agree with you, and you're absolutely right. It is a flawed system to the extent that it has a human element that it recognizes is very important. That, to your point, we don't want anyone to be left on the streets on the side of the road, to die from
but that private system can't work that way, can it?
But the reality of it is there are ways in which we can begin to address those types of concerns, to deal with those people who have fallen below even the safety net that we have in healthcare through a Medicaid system, for example, for the very poor, to make sure that they have access to that system. Again, let's fix what's right in front of us instead of trying to remake it and rebrand it and redo it in a way that's going to cost us more money, spend dollars we don't have, grow the influence inside of the size of the federal government, and put that doctor-patient relationship at jeopardy.
Two quick things before we go. For one,
Sure.
have you spoken to Senator Snowe of Maine? And if you haven't, what would you say to her once you do?
I have not had the chance to speak to the senator today. I've been tied up on a few other things.
But once you do,
if I would speak, I think when I speak to her, I would say, hey, I'm disappointed in the vote. I think that, you know as well as I, that Republicans very much want reform, health care reform for this country. We don't believe this is the kind of health care reform that's going to be in the best interest of the country. So work with us to help us get the Democrats on the right page here. And again, this is just the first vote that she's cast. It's one of many votes that are going to have to take place. And we're hoping that as we go forward, more and more people will see that this broad-based government grab of health care is not the way to do it. A slow, steady, bottom-up doctor-patient.
Now, those are the talking points, but that's not really true.
No.
Come on, Chairman.
No. Hey, Shep, you know me. I'm not a talking point guy. That's honestly how I feel about it, because I see the effects of it, and I know ultimately what it means for my mother and for me.
Right. All right.